YouTube world. It's Miss Patty with For Your CNA, and we're here with our live CNA game show. And I'm super excited to be joining you today with this. I wrote some really good questions today. Some are a little bit harder, some are probably a little easy for you. So we'll wait for everybody to come on in. I'm just getting my chat set up here. So when you come in, give me a quick hi. Let me know that you're here. And I'm just pulling up my chat so I can see what you guys say. Hi, Retha. Hi, Helen. Hello, Jorge. Hi, Anid. So excited to join you today. I hope everybody is having a fantastic Tuesday. We're going to give everybody just a few minutes to come in and get settled. Hi, Tatiana. Hi, Marie. Good morning. Hi, Anid. Good morning, guys. So exciting. All right. So for those of you that don't know how this works, let me go through this with you. We're going to have 15 questions. They're all multiple choice. Very similar to the types of questions that you're going to see on the state exam. So similar in content, which means the topics that are covered, and similar in presentation. So these are going to be written very much like the way that you're going to see the test questions on the written test presented. So this is a pretty good indicator of the types of questions that you'll see. And we are going to, I got a notification there. Good morning, Denise. So let me get this up here. So here's the rules. Each question is going to be displayed. I actually am going to display it for about a minute. After I read the question to you, you'll have about 45 seconds to respond. And when you want to choose the answer, you're going to type into the chat 1, 2, 3, or 4. So 1, 2, 3, or 4. And it's only going to read your first answer. So don't be like super quick. You got to think about it. It's only going to read your first answer. But when you type in 1, 2, 3, or 4 into the chat, the system that I'm using reads your answer and it's going to assign you points. So the quickest person to get the right answer first is going to get the most points. And it'll keep track of your progress on the leaderboard. And at the end, we'll announce our winners. We give prizes to the top 3. So first place is going to get the CNA card game and a badge holder. Let me get the badge holder to show you. Badge holder. Second place also gets the badge holder and a bracelet. And third place gets a keychain, an inspirational keychain. So you're playing for prizes. Now, I do have to say that we only ship prizes out to those in the United States. So if you're playing from somewhere else, you're more than welcome to play, but I can't ship the prizes because we're not really set up for all of that. So we only ship the prizes to people in the mainland U.S. Okay? So anybody else is welcome to join in. They just won't get the prizes shipped to them. Marie says, my niece would like to pass the written test and she is studying hard. Well, you're in the right place. Make sure you let her know about this. All right, so we are in and ready to go. So hold on, let me just pop this chat out so I can see it. There we go. All right. So you guys ready to get started here? If you're ready, say ready in the chat. Go ahead and let me know you're ready. Say ready in the chat. Go ahead and let me know when you're ready. Are you ready? Okay, looks like we've got some readies. Okay, all right. There does seem to be just a little bit of a lag. Just kind of keep that in mind. Just a little bit of a lag today. I don't really know why, but we'll go with it. All right, so here we go. We're going to get started here in about 10 seconds. Warm up those fingers and get ready. All right. First question. Touching a resident without their permission is called 1, harassment, 2, empathy, 3, punishment, or 4, battery. So touching a resident without their permission is called, so type in the chat 1, 2, 3, or 4. If you want to choose harassment, type in 1. If you want to choose empathy, type in 2. If you want to choose punishment, type in 3. And if you want to choose battery, type in 4. So you got about 20 seconds left. Go ahead and lock those answers in. 20 seconds left. Okay, and the correct answer is number 4. Correct, battery. Touching a resident without their permission is battery. And that's kind of important for us to know because sometimes in healthcare, we forget that patients have the right to say no. In fact, patients can say no at any time for any reason, and it has to be respected. So we kind of need to keep that in mind. And if we override their right to say no, we can actually be charged with battery. It's no different than me coming to your house tomorrow and forcing you to do something that you don't want to do. Just because a patient is in our facility doesn't mean they're giving up their right to self-determination. So we need to protect this right. All right, looks like Tatiana got that one right first, followed by Jody Ann, Denise, Helen, and Alina. Good job, guys. Very good job. All right, so we're going to move on to question number 2. Which of the following is not an example of an advanced directive? 1, resident rights. 2, power of attorney healthcare. 3, living will. Or 4, do not resuscitate, or DNR. So which one do you think is not an example of an advanced directive? Type into the chat 1, 2, 3, or 4. You've got about 30 seconds. Go ahead and lock in your answer. Okay, go ahead and lock in your answer. Which of the following is not an example of an advanced directive? Resident rights, power of attorney healthcare, living will, or do not resuscitate. This one's a little bit harder, isn't it? A little bit harder. All right, the right answer is residence rights. Residence rights is not an advanced directive. Residence rights is granted to everybody. They're just basic human rights that we are protecting when a person is living in an institutional setting. So it's a list of guidelines that we have to follow, but it is not an advanced directive. An advanced directive tells us as healthcare workers what the patient wants done if they are unable to speak for themselves. So things like, do they want CPR? Do they want to be on a feeding tube? Do they want all measures taken? Do they want to continue on life support if they're not able to make decisions? So that's an example of an advanced directive. So it looks like Shells came in first on that one, followed by Tatiana, Jorge, Anid, and Marie. Good job, guys. Very good. Thank you, Jorge. I appreciate that. All right, number 3, a radical change in a dementia patient's condition that occurs in the afternoon or evening is called 1, Alzheimer's dementia, 2, sundowning, 3, perseveration, or 4, night terrors. What do you guys think? A radical change in a dementia patient's condition that occurs in the afternoon or evening is called 1, Alzheimer's dementia, 2, sundowning, 3, perseveration, or 4, night terrors. What do you guys think? Go ahead and lock in your answer. Type into the chat 1, 2, 3, or 4. Got about 10 seconds left. Go ahead and lock those answers in. And our correct answer here is, most of you guys got this one right, sundowning. Very good. That is correct. Sundowning can happen when a patient has Alzheimer's. Alzheimer's is a type of dementia. Sundowning is a symptom. So sundowning can occur with patients with Alzheimer's, but it is not, that's not what we call it, a sudden personality change in the afternoon. Perseveration is repeating the same thing over and over and over again, and night terrors are particularly vivid dreams that disturb a patient's sleep. So sundowning is the term that we're looking for, and if you work in a dementia unit, you will probably see sundowning. It's a radical change in the afternoon or evening. You can have a sweet little lady that's all of a sudden cussing like a sailor. So it looks like Tatiana came in first on that one, followed by Alina, Audrey's, Jorge, and Jody Ann. Good job, guys. Very good job. Let's move on to question number 4. Here we go. Which of the following vital signs would need to be reported to the nurse immediately? So we're looking for vital signs that need to be reported immediately. 1, pulse of 60, respiration rate of 12. 2, blood pressure 92/56, pulse 114. 3, temperature 99.1, pulse 98. Or 4, blood pressure 118/76, pulse of 100. Which one of those would you need to report to the nurse immediately? So 1, 2, 3, or 4. Go ahead and lock in your answers. Type the number into the chat for the choice that you want to make. 1, 2, 3, or 4. Oh, see, I thought this was going to be a hard question. All right, most of you guys got that one right. That's right. Blood pressure 92/56 is low. So 100 to 119 is normal for the top. 60 to 79 is normal for the bottom. We are off of that on the low end for both of these values. And the pulse rate is elevated because normal pulse is 60 to 100. So this reading, a low blood pressure and a high pulse rate, is very, very concerning for us as nurses because this indicates some sort of shock in the patients. We got to get in there and find out why. So low BP, high pulse rate is always a red flag. Now, number 3, temperature 99.1, that's actually still in normal values. Pulse of 98 is on the high end, but still normal. So it looks like Tatiana came in first on that one, followed by Jorge, Jody Ann, and Alina. Good job. Very good. So yeah, that one should have been a little bit trickier, but you guys picked up on that really quick. I'm super proud. Number 5, you are assisting a patient with a DNR eat lunch when they begin choking. What should you do? 1, go get the nurse immediately. 2, remain with the patient throughout the dying process. 3, perform abdominal thrusts. Or 4, ask the patient what they want you to do. So you're assisting a patient who has a DNR. So they have a DNR in place and they're eating lunch and begin choking. What should you do? 1, go get the nurse. 2, remain with the patient throughout the dying process. 3, perform abdominal thrusts. Or 4, ask the patient what they want you to do. Yeah, this one's a little harder, isn't it? Now we're getting into medical ethics. Medical ethics. This is a little bit harder. So go ahead and lock in your answers. 1, 2, 3, or 4. Yeah, the right answer is to perform abdominal thrusts. The DNR has nothing to do with this situation. A DNR only goes into effect if the patient is dying from whatever it is that we expect them to die from. So if they have dementia and it's end stage and we know the dementia is going to result in their death, as long as they're dying from dementia, they don't want heroic measures. But this is not that. Choking is not dying from the expected event. So choking is an emergency. We have to act on it. If you go get the nurse, the patient's going to die before the nurse gets there. it's an emergency situation that requires emergency intervention. So yeah, we would perform abdominal thrusts. So it looks like Audrey's came in first on that one, followed by Catherine, Marie, Castro, and Jorge. Good one. Yeah, that was a trickier question, wasn't it? I warned you. Yeah, some of the questions I wrote today are a little bit harder. All right, number 6. What is the most important function of a CNA caring for an immobile patient? 1, turning the patient every 2 hours. 2, providing pericare every 2 hours. 3, report all changes promptly. And 4, perform RON each shift. So what is the most important function of a CNA caring for an immobile patient? Turn them every 2 hours, provide pericare every 2 hours, report all changes promptly, or perform range of motion each shift. What do you guys think? What is the most important function? Go ahead and lock in your answers. This one's a little bit tricky too. Today's questions are a little bit harder. You've got about 3 seconds left. Go ahead and lock those answers in. Yeah, nobody got this one. Believe it or not, reporting all changes promptly is the most important function. So we want to be looking for red areas, muscle contractures, change in bowel habits and mentation, how their cognitive processes. Reporting all changes promptly is actually the most important job. Yes, those other tasks are all important as well. If we turn a patient, they're less likely to get skin issues. If we provide pericare every 2 hours, it helps promote urinary health. Performing range of motion each shift, as indicated on the care plan, will help prevent contractures. Those are all important tasks, but the most important is to report all changes promptly. Yep, I know. That one was hard, wasn't it? I got tricky on you, I know. But that's a very similar question to one you might find on the state exam. So number 7, what is the name of the law that keeps patients' health information private? 1, NAFTA. 2, OSHA. 3, OBRA. Or 4, HIPAA. So what is the name of the law that keeps patients' health information private? 1, NAFTA. 2, OSHA. 3, OBRA. Or 4, HIPAA. Go ahead and lock in your answers. 1, 2, 3, or 4. 1, 2, 3, or 4. So the name of the law. Do you notice that today's questions are a lot on legal aspects of CNA work? Are you starting to see my topic for the week? Okay, you got about 3 seconds left. Get those answers in. Correct, HIPAA. Most of you got this one right. Good job. So HIPAA, this never really made sense to me. It's Health Insurance Portability and Privacy Act, or and Accountability Act. So Health Insurance Portability and Accountability Act. It doesn't say anything about privacy in there, so it's such a big part of HIPAA. But that's really what HIPAA is all about, is giving the patients the right to use their information the way they want it used. So it restricts caregivers from being able to pass around information that they don't really have the right to share. So HIPAA is the law that we're looking for. OBRA is all about regulating health care, and OSHA is about keeping healthcare workers safe. So Jade came in first on that one, followed by Jorge, Tatiana, Tiffany, and Alina. All right, we're about half done, guys. Good job, half done. So we're moving on to question number 8. The type of care provided in a rehabilitation center focuses on 1, end-of-life care. 2, diagnosing illnesses. 3, restoring function. Or 4, dementia care. So the type of care provided in a rehabilitation center focuses on 1, end-of-life care. 2, diagnosing illnesses. 3, restoring function. or 4, dementia care? Go ahead and lock in your answers. 1, 2, 3, or 4. And I actually talked a little bit about this on our last weekly live last Thursday. So if you tuned in for our live, I talked a little bit about rehabilitation centers. All right, so you got about 5 seconds left. Go ahead and lock those answers in. The right answer is restoring function. So number 3, to the highest level possible. Now, it's important to have, we have to manage our expectations here. If we have a stroke patient, we may not be able to restore them to the level of independence that they enjoyed before the stroke. We're trying to work within the confines of what's possible for that patient. So restoring function to the highest level possible. And this is usually done in a rehabilitation setting. Now, a lot of times this will be done in an inpatient unit for a couple of weeks to a couple of months. And then the patient might actually transition to an outpatient rehab where they continue to go for weekly sessions to maintain that level of independence. So it looks like Tatiana came in first, followed by Jorge, Alina, Anid, and Audrey's. Good job. Great job. Moving on to question number 9. A long-term care resident who wishes to file a complaint of neglect against a facility or a caregiver should be directed to 1, the Ombudsman, 2, the Better Business Bureau, 3, the Resident Council, or 4, transfer to another facility. So if we have a long-term care resident who wants to file a complaint, should we direct them to an ombudsman, the Better Business Bureau, the Resident Council, or should we tell them to transfer to another facility? So lock in your answers. You got about 20 seconds. Do we want to tell this person to contact the ombudsman, the Better Business Bureau, the Resident Council, or do we want to tell them transfer to another facility? Got about 5 seconds left. Go ahead and lock those answers in. Good job, guys. Most of you got this one right. The Ombudsman, and that's really what they're there to do. Absolutely. I was trying to trick you on that one, but looks like you guys are pretty up to speed on those ombudsmen. So that's a good job. So an ombudsman is an impartial third-party volunteer. They don't get paid by the facility or by the patients, and they're just a third party that can help mediate. So if a patient has a complaint, it's hard to complain to somebody if they're taking care of you because they can retaliate. So you may not feel free to file a complaint. So the ombudsman is there to make sure that the complaint is heard and addressed, but also to make sure that the patient's not being retaliated against either. So that ombudsman role is super important, and it is a volunteer role. So if you've got some time in your life, you might want to consider that. Looks like Castro came in first on that one, followed by Tatiana, Audrey's, Jody, and Jade. Good job. Very good. Moving on to question number 10. Now we're about 2/3 of the way through here. A CNA is only permitted to perform tasks that, 1, they learned in CNA school, 2, they have been trained to do, 3, are outlined in OBRA, or 4, they feel are appropriate for the patient. So a CNA is only permitted to perform tasks that, 1, they learned in CNA school, 2, they've been trained to do, 3, are outlined in OBRA, or 4, that they feel are appropriate for the patient. So what do you guys think? Go ahead and lock in your answer. You got about 20 seconds to go. 20 seconds to go. Actually, 15 now. Go ahead and lock in your answer. See, I tried to trip you up with that one. You guys are too good. You really are. You're too good. It's hard for me to write questions that are hard enough for you. Yeah, CNA is only permitted to do tasks that they have been trained to do, and not all tasks are going to be taught to you in CNA school. So we have to understand that once we get out into the workplace, there may be other tasks that we're going to need to perform that they're going to train us on specific to that workplace. So 1 and 2 seem very similar, but the big difference is that number 2 allows for training to happen outside of the school in the workplace. And that's where a lot of your training is actually going to occur. CNA school teaches you enough to keep you safe and keep your patients safe from you, but most of your additional tasks will be learned on the job. So good job. Number 2 was correct. Looks like Castro came in first, followed by Jade, Audrey's, Jody, and Tiffany. Good job. All right, moving on to question number 11. Question number 11. Which of the following tasks should a CNA be prepared to perform? 1, administering an oral medication to an alert patient. 2, performing a tube feeding on a stable patient. 3, identifying when a walker is needed for safety. Or 4, all personal care on an unconscious patient. So which of the following tasks should a CNA be prepared to perform? This is a scope of practice question, guys. So 1, administering an oral medication to an alert patient. 2, performing a tube feeding on a stable patient. 3, identifying when a walker is needed for safety. Or 4, all personal care on an unconscious patient. So about 5 seconds. Go ahead and lock in your answers. Wow, you guys are good. Wow. I thought for sure I'd be able to trip some of you up with number 3, identifying when a walker is needed for safety, but you didn't fall for it. You all got the right answer. Absolutely. So 1 is not correct because CNAs don't administer medications. That's not our role. Yes, you can take additional training, but it doesn't say that, right? So we can't pick that. Performing a tube feeding, that is never a CNA function. So that's not part of CNA training. Identifying when a walker is needed for safety, that's actually going to be reflected in the care plan. A lot of CNAs get that mixed up and they will grab a walker if they think the patient needs it, but it really needs to be indicated in the care plan. But yes, we do all personal care on unconscious patients, so that's the right answer. So Tatiana came in first on that one, followed by Jorge, Jody Ann, Castro, and Tiffany. Great. Very good. All right, moving on to I'm going to have to get harder on these questions. Moving on to question 12. Which of the following is an example of an open-ended question? 1, can you describe your headache to me? 2, are you ready to get up? 3, would you like a snack from the kitchen? Or 4, would you like your shower now or after lunch? So which of the following is an example of an open-ended question? 1, can you describe your headache to me? 2, are you ready to get up? 3, would you like a snack from the kitchen? Or 4, would you like your shower now or after lunch? Go ahead and lock in your answers. You've got about 15 seconds. Lock in those answers. We're looking for an open-ended question. So this is all on communication. Open-ended. Oh, this one was a little harder for you. All right. So yeah, number 1 is actually the right answer here, and let me explain why. An open-ended question requires words to answer. If we're looking for the answer here that would give us the most words, right? Open-ended means we want them to talk. So number 2 is just a yes or no. Are you ready to get up? Yes or no. Number 3, would you like a snack from the kitchen? Again, yes or no. They either want one or they don't. Would you like your shower now or after lunch? 2 choices, now or after lunch. Not a lot of conversation there. Can you describe your headache to me? That's an open-ended question because it requires words to answer. So that's how you identify an open-ended question. Looks like Jade came in first on that one, followed by Ruth, Jorge, Tiffany, and Audrey's. Good job. Yeah, it was tricky, wasn't it, Jody? But if you can just remember that little tip, open-ended question requires words. All right, number 13. A CNA notices the patient has a strange odor and has had 2 loose stools this shift. The CNA should, 1, send a stool sample to the lab. 2, only report it if you feel it's abnormal. 3, ask the patient what their normal bowel patterns are. Or 4, notify the nurse of your observations. What do you want to do with this? CNA notices the patient has a strange odor and has had 2 loose stools this shift. What would you like to do? Do you want to send a stool sample to the lab? Do you want to report it only if you feel it's abnormal? Do you want to ask the patient what their normal bowel habits are? Or are you going to notify the nurse of your observations? What do you guys think? Go ahead and lock in your final answer. You've got about 5 seconds. And the correct answer is notify the nurse of your observations. Absolutely. Now, this patient might possibly have C. diff because C. diff produces an odor, and the patient's going to have multiple loose stools if they have C. diff. And that's kind of the clue I'm giving you here. But it could be other reasons as well. And it might actually be completely normal for the patient. But that's not our decision to make. This is something that we observe, and anything we observe, we always have to report. The nurse is the one that's going to figure out whether it's an abnormal thing or if something needs to be done about it. So the other actions there are not, you're making the decision. It's not in your scope of practice. So looks like Castro came in first, followed by Tatiana, Anid, Jody, and Jade. Good job. Moving on to question number 14. It's only 2 more to go. Question 14. During shift change, you are informed that a patient has a DNR and is deteriorating. You should, 1, check on the patient frequently throughout the shift. 2, consult the chart to verify the DNR status yourself. 3, notify the family to come say their final goodbyes. Or 4, decide who is going to do post-mortem care. What do you guys want to do? Our patient has a DNR and is deteriorating. What do we want to do with that? Do we want to check on the patient frequently, consult the chart to verify it ourselves, notify the family, or decide who's going to do the post-mortem care? What do you guys want to do with this patient? You've got about 10 seconds left, so lock in your answers. 10 seconds left. All right, you guys are good. The correct answer is check on the patient frequently. Absolutely. We don't need to consult the chart to verify this. We don't need to do that. That's not our role here. The nurse is the one accepting the liability. So number 2, that's just a time waster. Number 3, notify the family. Don't do that. That's not your role. That is the nurse's role. And number 4, decide who's going to do post-mortem care. Yeah, you probably may do that. I don't know. The nurse should assign it. But that's not the best answer. So this one, if you were looking at number 4 thinking, yeah, that might be, you're right, it might be, but it's not the best answer. The best answer here is to check on the patient frequently throughout the shift. So on the test, you may have 2 answers that you're torn between. Remember to always pick the best one. So that's why that question's a little bit tricky. So Castro came in first on that one, followed by Jorge, Tatiana, Anid, and Jody. Good. Very good. All right, so we're going to move on to the last question. Regarding telephone use by a long-term care resident, telephones can be used, 1, only by residents who have earned the right. 2, anytime, and privacy must be provided. 3, when residents are supervised and monitored. Or 4, only if they bring their own phone. So telephones being used by long-term care residents, which of the following is correct? They can be used only by residents who have earned the right. They can be used anytime and privacy must be provided. They can be used when residents are supervised and monitored. Or they can be used only if the patient brings their own phone. So what do you guys think? Go ahead and lock in your answers. This one's a little bit trickier, isn't it? Lock in your answers. And the correct answer is number 2. Telephones can be used anytime, and we have to give them privacy. Patients in long-term care, this is where they live. Imagine if every single phone call you made was monitored. That would be very uncomfortable. It would also be a violation of their right for freedom of communication to restrict access. So number 2 is correct. Number 2 is correct. Yep, they can be used anytime. If the patient wants to make a phone call at 11 p.m., then they have the right to make a phone call at 11 p.m. It's not our job to tell them no. Just like you can pick up the phone at your home and make a phone call at 11 p.m. Now, the person you're calling may not appreciate it. I don't know. But we have to understand the rights here. So Tatiana came in first on that question, followed by Jorge, Castro, Audrey's, and Anid. So good job, guys. We're going to check out our final scores here. Tatiana came in first, followed by Audrey's and Jorge. Those are our top 3 spots. So that was a close game, guys. So those of you who won, you need to send me, let me type this in here, you need to send me an email. So for your CNA at gmail.com. Okay, so let's see, who was first? Oh, Tatiana is first, Audrey's, and Jorge. So what I want you, let me write that down. Tatiana, Audrey's, and Jorge. Okay, so I want you to send me an email and let me know your screen name, what place you took, and your real name and address so we can get these prizes out to you. So Tatiana, Audrey's, and Jorge. I know Jorge won last time too. Good job. Jorge says, good game show. I loved it, learned a lot. Thank you. I appreciate that. Very good. I hope you guys enjoy this format. I really like presenting questions in this way. It's much more interactive than just reading a question yourself on a screen and choosing an answer. This just makes it a little bit more fun. Plus, you can compete for real prizes, which is always awesome. All right, so the 3 of you that won, Tatiana, Audrey's, and Jorge, make sure you send me an email. Let me know what place you came in, your screen name, your real name, and your mailing address. And we'll get that out to you really quickly so you'll get your free prizes. So congratulations to you guys. The rest of you did fantastic as well. I'm super proud. And I know that those of you getting ready to test, you're gonna do awesome because you guys you're good. It's getting hard for me to write questions that are challenging for you because you're so smart. All right, so that's going to end today's game show. We do this on the first and third Tuesday of each month. So the first and third Tuesday of each month, and we do give out prizes each time. The next one coming up, I may not be able to do. So the next one we have coming up, which is the first week of October, I'm actually going to be on a plane at this time. So I'm flying out to Texas to go to a conference for YouTubers, and I'm super excited. We are in the the top 8% of all YouTube channels in the U.S., we're in that. We're in the top 8% of all YouTube channels. That's amazing. Look at what you guys have accomplished. This is amazing. And it's all because of you. So thank you. But I'm going to go to the conference. I will be live streaming from the conference here and there. So if you haven't liked our channel, you might want to do so you'll see when I go live. Because I won't be on a regular schedule that week because I've got conference things to go to. But I will go live and share it with you guys. So if you want to catch it, make sure you subscribe and ring the bell so YouTube will notify you when I go live because I don't know what time it's going to be. And I'd love to take you along for the ride because it's going to be a lot of fun. So the next game show, which will be the first week in October, we're going to skip that one because I'll be on a plane and I can't live stream from the plane. So just keep that in mind. I'm going live tomorrow for class. It's class 4. And on Thursday, we're going to have a lesson, so make sure you tune in for that. Thursdays at 3, that's our normal weekly lesson. So a lot of opportunities this week. I'm basically live every day this week. So a lot of opportunities for you to join us. And we're so thankful when you do. I hope you have a fantastic day. Go do something fun. And until next time, happy caregiving. Bye. Oh, Catherine, I'll be going outside of Dallas to Irving. Irving, Texas is where we're going to be. So I've never been. It'll be fun. All right, guys. See ya.